Our next guest says when it comes to cosmetic dentistry, typically women do it, but with a more competitive workplace and a greater emphasis these days on looking younger, more men are turning to things like veneers and teeth whiteners too. Here to tell us more about it is dentist Dr. Terry Alani and her patient Robert McMillan. Hi there.
Hello.
Okay, so Robert, what were you noticing about your teeth, and had you cared before or?
Not particularly. I had straight teeth. I had braces when I was younger, but over the years, because of stress, I'd ground my teeth and clenched, and I lost a lot of length. So I had a jagged smile. They chipped easy, and my canines, for lack of a better word, becoming more prominent. So my smile became kind of scary.
Yeah,
It looked like Count Dracula.
Kind of scary. Yeah, I'd like to drink your blood. Okay, so and so you decided I got to do something about it. And
yes.
Dr. Alani, this is something that's common. We can have teeth that may start out looking okay, but things can change.
Exactly. As we get older, our teeth get yellower. They get shorter. And we can develop spaces in between the teeth that we didn't have before. So, you know, men are spending up to $10 billion a year annually on cosmetic procedures.
Wow.
So now they're actually choosing cosmetic dentistry. Now, this is a picture of Robert before. You can see on the right side, his teeth are not the same length at all.
Right.
That is his before picture, and there's his after.
Wow.
And this was done relatively simply with just 4 veneers. We did not veneer every tooth. It's just the 4 front ones.
Yeah, the ones that you would mostly see when you smile.
Yes.
And so after it was done, what did you think?
Well, I'm not a person that looks in the mirror often, but I could see the results in the reflection of other people. They were I'd smile, they would smile back. It's like the people were a mirror. I could. It's really heartwarming. I present a much warmer, friendlier persona.
Yeah. Because
and
before you were trying to kind of hide your smile a little bit.
I kind of had. I kind of looked down and kind of had also.
No, you didn't really see her smile either. When he first came into the office, I noticed that when he smiled, you really didn't see his teeth.
Yeah.
He's a nice-looking guy, so I call, you know, repairing your smile or restoring your smile sort of chick magnets.
Yeah, yeah.
Girls like that. And, you know, guys come into my office and they'll say, well, what can I do to improve my smile? And I said, well, are you single or is it for your business? Because more and more men now, especially in their 40s, 50s, and as they get older, are realizing the importance of cosmetic dentistry in the business environment and also in their personal relationships.
Yeah, because you, Dr. Alani, you're single, and the first thing you look at with a man is, are those teeth right? Because if the teeth aren't right, they gotta go. Right?
Exactly.
All right, let's. So he did the veneers, and like you said, you don't have to get the whole thing done. Just the ones that you basically see in that smile. There's some other things that you can do, starting with probably the easiest, and that's just teeth whitening.
Exactly, teeth whitening. And like I said, as we get older, our teeth do yellow, and especially if you smoke. Your teeth will get very yellow, but with teeth whitening, it will bring your teeth back up to where they were when they were younger.
Yeah, and we have some pictures, some examples, I think, of just the difference that it can make. Okay, but you can imagine what that is. But you're right, and it also sends another message to people when your teeth look like they're dirty.
Right, right. A beautiful smile speaks when you don't. I always say that on the air because it's true.
Yeah. Also, the thing that you came on here a few months ago with this thing called Snap-on Smile. And it was amazing, the response, because, I mean, look at this right here.
This is actually a patient that I just did a couple of weeks ago. He was a gentleman that didn't have his front teeth. He wanted to restore his smile. And we did a snap-on smile, and it was just incredible.
Yeah, because otherwise you could do dentures and things, but that's much more expensive.
Right, this is something that patients are, it's just gone crazy.
Yeah.
Actually, it has gone crazy, and it's fairly new. And basically, all we do is take an impression, send it to a lab in New York, and then it comes back, and it's a tray that fits over your existing teeth. So it can take the place of a partial, or if you just want it to go out, a family wedding you have, and you don't like the way your teeth look, this is a great alternative.
And it literally snaps on in a couple of seconds.
It literally snaps on, and patients, the first thing I hear is, oh my gosh, it's not loose, it fits tight, they can speak, and they can eat with it.
Yeah. All right, we talked about veneers, but crowns, what's the difference between the two?
Okay, a veneer is a little bit more conservative than a crown. If you think of a fingernail, how women go and have their fingernails done, just a fake fingernail that goes on the front of the tooth, that's more a veneer. A crown actually covers the entire tooth. Now, the thing is that both of them are all porcelain. Usually in front teeth, we now make crowns where there's actually no metal. So you don't have that black line.
Right.
So if a tooth is broken down, we'll usually crown it. If not, we'll try to just place veneers on.
What's more permanent?
Veneers and crowns are the same as far as impermanence. The snap-on smile, of course, is a reversible procedure. The whitening is permanent, but you have to keep it up and maintain it. But veneers and crowns, they can last. I have a case that's lasted 20-something years. It depends on how the patient takes care of their teeth.
And the nice thing with the snap-on smile, you can at least get a sense of what you really like, and then you can determine whether you want to really invest in something that's much more permanent.
No, exactly. It's a preview. Yes.
All right. So, how's the attention been from the ladies?
It's opened not a lot of doors. There's a lot of response. Before, people didn't know if I was smiling or I was mad, but I can just show a little teeth, and they are more open and attentive, willing to talk. It's just appearance is everything. And in those first few moments, if you present a smile and you're open and friendly, it opens up conversations easy.
I think maybe a lot of doors may have opened right now that the women have seen you on TV here. But anyway, Dr. Lonnie, you wanted to add?
No, I was just going to say, articles in the popular media now are stressing the importance of a really nice smile in the business place. And it's really important. I don't think, I have patients that come in, and some are CEOs of companies. They have all different jobs, and some come in and their teeth, they don't take care of their teeth, and I don't understand why that is not an important part. I don't understand it. So usually their wives will come in with them, and then they get it done, and then they think, oh my gosh, I should have had done that years ago.
Exactly. All right, putting your best face forward. Thank you very much. For more information, log on to texastoothlady.com or call 713-621-5141, 713-621-5141.